Welcome back to the podcast, you guys. I'm so excited to have Dr. Staci Whitman on today's podcast. She's a dentist. She grew up in Maine, eventually moving to Boston, where she attended Tufts University School of Dental Medicine. Following her passion for working with children, she then completed 2 years of pediatric dental training, earning a certificate in pediatric dentistry from Oregon Health and Sciences University. After experiencing the loss of her mother, Dr. Staci committed to taking a more whole body, functional, root causes, holistic approach to life. I love that about you, Dr. Staci. She is committed to finding only the most up-to-date treatments and the most non-toxic options for children and their families, all while offering education, support, and love to her patients and families. She is now the clinical director of NoPo Kids Dentistry, a holistic pediatric dental practice in Portland, Oregon. And I am so happy to have her on the show today. Dr. Staci, thank you for being here.
Yay. Thank you, Kelly. I'm so excited.
We're just like fangirls of each other on Instagram. So it's fun to see your face. It's fun to see your face. And just, after becoming a new mom and trying, I've always tried to do right by myself and encourage Chris to do, have a holistic approach to the way he takes care of himself. But it became like even more important to me to have options like holistic dentistry for my children, like Sebastian. So I'm just curious to learn a little bit more about your journey. Like, how did you get into dentistry? And then how did you steer your career towards more of a holistic approach?
Yeah. Well, thank you for having me, by the way. I'm honored, truly. And I am a fangirl of yours. So this is really exciting for me. So I, like you mentioned, I grew up in Maine. I was surprisingly not really a science kid. I was an art, theater, dance human. But when I got into college, I realized that perhaps that wasn't the career choice that would be safest for me. I was trying to get out of Maine. I loved science and I put it all together. I had a really terrible bicycle accident when I was 10 and I fell off my bike and I knocked out, I broke a bunch of my permanent teeth. I broke my maxilla. And so I had a lot of experience at the dental office. And so I put kind of my art background, my love to work with my hands together with that experience. And I thought, well, why don't I try dental school? So I became a pre-med major and moved to Boston. I got into dental school, went through a traditional program and graduated. I worked for a few years as a traditional dentist and then moved out west, packed up my Forerunner, thought the West Coast would be a good change for me. And I just found as I was working in different clinics that what I was doing just wasn't resonating with me. I wasn't finding true joy in my dentistry. I wasn't really invoking any change. I kept seeing cavities coming back and habits not changing. And so I realized I wanted to get more upstream. And for me, that meant working with children, educating right out of the gate how to prevent cavities, educating their parents. So I decided to go back and to my residency and I went into pediatrics. And then again, it was kind of a traditional training program. I worked for a few years. Everything we were doing, I just wasn't feeling I was making a difference. And then I did lose my mother and I kind of changed my whole lifestyle outlook and looked at root causes and prevention. And eventually just kind of morphed into my current practice. I opened a holistic functional practice in Portland. And that's where we are today, where we really focus on educating and prevention and root causes of disease and oral health.
I love that. I'm so sorry about your mom. I know sometimes these, very traumatic events, losing loved ones early can really change our course.
Yes.
And so I would say that maybe the only silver lining in that experience, I'm sure, but you're helping so many families and I'm so thankful for that and for all the education you're providing. So let's get into some of that education if you don't mind and what holistic dentistry is and some of the biggest differences from conventional dentistry.
Yeah, that's a great question because it gets confusing. So I like to think of holistic dentistry. It's really under the umbrella of functional dentistry. And so we know a lot about functional medicine. Again, it's looking at root causes. But a traditional dental model is really one of surgical treatment. So it's kind of end stage disease. So we're really trying to get more upstream to really get to root causes and educate parents on just how to prevent all these issues from happening to begin with. We focus so much on diet. Cavities are not inevitable. They're mostly all caused from our dietary choices. We also focus a lot on our airway and sleep health as well, which we can get into a bit later. And then the oral microbiome, which we talk so much about the gut microbiome. It's getting so much attention right now, but I'm hoping the oral microbiome gets its place on center stage soon too, because they're quite related. And so, really appreciating this microbial colony that is happening, this kind of rainforest effect that's happening in our bodies. We also focus on using the cleanest, most non-toxic materials. And we really like to use minimal treatment also in the kids and allow the body's innate ability to heal to take hold. Another focus that I have is sustainability and regenerative practices, being mindful of our planetary health too. So, just to simplify, functional dentistry, holistic dentistry is a whole body approach. The mouth is connected to the rest of the body. We're trying to get the mouth back into the body. Things that happen in our oral cavity, they affect the rest of our bodies too. And so it's educating the public about that. Medicine went one way, dentistry went another way. They've been separate for so long. We're just trying to get them back together and create public awareness about that.
Oh, you're a rock star. I love it. I mean, just like
Thanks.
prevention, the oral microbiome. I want to dive into all of these things and how we can prevent cavities through diet. So let's just take them one at a time.
Sure thing.
Can you talk about mouth health and the oral microbiome and some problems you see when there's dysbiosis there?
Yes, absolutely. So, cavities, so when we're in dysbiosis, that is when we start seeing cavities or demineralization. So our teeth are constantly undergoing a demineralization and remineralization process. Every time we eat, our pH of our mouth drops and our mouth becomes more acidic. And that's a natural process. But we want to keep that in balance. So if our saliva is healthy, we have calcium, we have phosphorus, all these beautiful ions that are helping to remineralize our teeth. But it's when everything is out of balance that we then see cavities start forming. We start seeing gum disease. Mouth breathing can lead to this too. So using certain products also, like we're inundated with disinfecting our mouths, sterilizing our mouths. It's kind of the same how we're learning, like we're just using too many sanitizers and bleaches and things in our homes. We're trying to disinfect our mouth. And so we're killing off our healthy, positive bacteria too. And they have a really important role in managing this demineralization, remineralization process. And so that's where we see dysbiosis mostly is, if you start seeing gum disease or cavities, it is a sign there are issues going on. But systemically speaking, we see a lot of issues in the mouth first. We can see Crohn's disease, celiac, ulcerative colitis, vitamin B12 and B6 deficiency, iron deficiencies, all can be seen in the mouth. And then gum disease, if your gums are bleeding, that's a sign of inflammation. And the mouth didn't get the memo that it needs to stay contained within its walls. So if there's inflammation in the mouth, there's very likely inflammation throughout the body.
Wow.
Yeah.
How do you see these autoimmune diseases and gut diseases like celiac disease and Crohn's disease? And how do you see deficiencies? Like, what are you visually seeing in the mouth when that's happening? I understand the blood from inflammation. I think anyone listening can say like,
Sure.
oh, I flossed my teeth and they're like puffy red and bleeding. Like, yeah, that looks like inflammation.
Yeah.
But how are you visually seeing that when you're working with a client?
Yeah, that's a great question. So specifically, a way to think about it too, the mouth is the beginning of the gastrointestinal pathway. And it's very similar. We call them like kissing cousins, and so we're doing a lot of study in the oral microbiome, but we do swallow 2,000 times a day. So we're swallowing our oral bacteria, and that is seeding our gut. Now, we don't quite understand how much is being killed by the hydrochloric acid in our stomach and how much affecting gut health. My guess is significantly. A lot of times patients will have gut dysbiosis and they're kind of doing everything correctly, but maybe they're just hitting this roadblock. Well, we need to start looking toward their oral health too. But specifically, so like ulcerative colitis or gluten sensitivity or celiac, we often see ulcerations in the mouth. And a lot of times we'll see these signs and symptoms in the oral cavity before there are more systemic signs and symptoms coming up. B12 deficiency, pernicious anemia is what it's called. You'll see a really red tongue and it will be kind of flat and people may say it's burning. So that can be something we see. Iron deficiency, the gums, the mucosa within the mouth can be pale. Angular cheilitis, which, B6 deficiency, you can see cracking in the corners of the mouth. There's vitamin C deficiency, so that was scurvy, right? So periodontal disease, people were losing their teeth. That was from vitamin C issues. So, the dentists have a big responsibility. We look in patients' mouths all the time, and it's just connecting all these things. It's really much beyond the tooth. And that's, again, that kind of functional holistic approach is we really can help guide patients to more clinical systemic issues, including vitamin D deficiency. So patients who tend to get a lot of cavities, we're looking deeper into that being related to vitamin D deficiency and also K2, which we can get into later more specifically when we talk about nutrition. But it's all connected, and I think the more we can educate patients on that and how important our oral health is for our systemic well-being, the better off we're all going to be.
Oh, it's so fascinating. I'm having an aha moment over here because I always used to think like, oh, I get really dry. I remember in college getting like those really dry cracks in the corner of my mouth. And then when I first saw Dr. Lekos, a functional medicine, an MD out in Los Angeles, that I refer so many of my clients to, he was like, you have a major deficiency in B6. And
oh, wow. Awesome.
And I haven't had that problem since.
Yeah.
I was the kid with loads and loads of chapstick. So
right, which perpetuates the issue a lot of times.
Super drying, like not, I remember, oh gosh, what was the yellow? There used to be a yellow
Carmex.
Oh
totally.
my gosh.
I was so hooked on it. Yeah.
People used to do that all the time. And don't get me like started with like whatever matte glass was. That stuff was horrible.
Gnarly. I know.
Yeah.
I know.
But I love this so much because you're giving people tangible takeaways on ways that they can kind of start to see, like, open your mouth, look in the mirror, ask your dentist.
Yeah. I mean, if you go back to Chinese medicine, the tongue is really important for dictating the health and mapping the health. So, really open your mouth, look at your tongue. Is it coated with like a white film? Does it look pink and healthy? Is it red? Does it burn? Do you get ulcers a lot in your mouth? Are you getting cavities and you can't get to the root cause of it? And there's several things that can be, but the big one is vitamin D. I mean, I am such a vitamin D advocate and knowing what your levels are. So I do recommend everyone, including kids, to get tested, especially if you're finding imbalances in the body. Because I think vitamin D is kind of the MVP for so many systems in our body, including our dental health and the mineralization of our teeth.
I love it. And we know how important that is right now in the middle of a pandemic and flu season and all that stuff. Yeah. So get on it, you guys. Get tested, get your vitamin D levels tested. Let's go back to the mineralization of teeth. You mentioned, calcium and all of these ions that are floating around in our saliva and supporting that mineralization. How can we support making sure that we have the minerals that our body needs? Do you recommend electrolytes? Do you recommend like salts? Do you like a mineral rich diet? Like how are we getting there to support oral health for ourselves and our kids?
Yeah, I mean, all of it. So it's the same way that you probably coach your clients. a whole food diet that's diverse in a wide range of different food types and phytonutrients. Hydration is incredibly important. I think so many of us are dehydrated. I do love trace minerals. So, I add trace minerals to my kids' water. It's so hard to get minerals now, even out of the cleanest, healthiest, most organic food. Our soil's depleted. That's a whole, the benefits of regenerative farming. We can talk about that, but I do love electrolytes. In fact, you got me hooked on the Element. Yeah.
Cheers.
I love it.
I'm drinking it right now.
Awesome. Yeah. I start my day every day that way. Collagen. I do really love high quality animal proteins. I think that's how we connected originally on Instagram, was a little discussion about that. I want to be respectful of people who choose not to eat animal protein, but it is really challenging to get some of the essential nutrients that we need for dental development, particularly our vitamin D, our B vitamins, and K2 also. So yeah, a diverse diet, hydration, and trace minerals are some of the big things I talk to my parents about.
Cool. Well, we'll definitely include your favorite trace minerals in today's show notes.
Sure.
But I also want to go dive a little bit deeper into this microbiome and some of the research that maybe you've seen coming out when it comes to dysbiosis. And also, I'm not sure, but maybe some people listening have heard of oral probiotics. So I kind of want to get your take on that too. And if that's supportive of oral health and what we should be doing. So let's talk microbiome.
For sure. Yeah. I love probiotics, but more importantly are prebiotics, right? So the prebiotic fibers that we need to eat to help support our healthy microbiome in our gut, it's also helping our oral microbiome. So, there are starting to be more probiotic rinses and things coming out, which I really love, or just simply chewing up a probiotic and kind of swishing it around the mouth. But again, that's where this wide range of food really helps benefit us, including all those good prebiotic fibers. But I do love fermented food too. We really encourage parents to look into getting their children to accept fermented foods from an early age. And cod liver oil is great to help with some dental development issues too. So there's a great book called Heal Your Oral Microbiome by Cass Nelson Dooley. I've read it several times. She's really kind of opened the gateway into this oral microbiome discussion. And I know I have colleagues that are doing research and working on other books that should be coming out soon, I hope. Just again, to get the oral microbiome more front and center. We're so focused on the gut, which we should be. That's, the center of immune health. But I think they're more connected than we're giving them credit for.
Definitely. I love that you brought up fermented foods and cod liver oil. I actually give Sebastian cod liver oil every day as his omega-3 vitamin D3 and a little vitamin A. And one of his first foods was sauerkraut juice.
Good. Yeah. My girls used to do that with like a shot glass.
It's one of them. There's some pretty amazing research on introducing bitter foods early and first versus the sweet potatoes, the pears, the apples, really using like egg yolks, avocados, sauerkraut juice, bitter greens, stewed meats, all that good stuff.
Yeah. And spices too. We used to use curry and turmeric, just a little bit, like cinnamon for our girls, just to help create that diverse palate, that adventurous eating too. I do believe earlier is better. That's not to say you can't change a child's palate if they're a bit older. Some of the listeners have older kids, but if you are pregnant or you just had a baby, start them young and don't be afraid to introduce some more complex flavors.
I totally agree 100%. I think we've been told do not salt your food and do not add spices until they're 1 or 2 years old. And it's like, no, I ate all the spice throughout my pregnancy. And yes, I toned it down for Bash, but we are keeping that. We always kept all that stuff. And the bitter flavors, the bright, spicy flavors, all of that, just to, get them excited. And I think if you're starting young, Right. It's better to get ahead of it than to try
Absolutely.
and catch up a little bit.
Yeah.
Okay, cool. So I will get after the show, I'll get your favorite rinses. We'll add those to the show notes if people are interested in their oral health. But I love that your focus is on whole foods and getting fermented foods and chewing up those non-starchy vegetables that are rich in prebiotics. It makes perfect sense to me. You're probably going to tell listeners that they need to chew a little bit longer too, huh?
Well, chewing is extremely important for jaw development. And so if we can dive into kind of airway health too, if you'd like, and jaw
Let's do
development. So, children's airway health and sleep health is really being considered a silent epidemic. I'm sure many of the listeners are familiar with James Nestor's book, Breath, that came out. I mean, he just is crushing it with bringing such a kind of bland subject to the spotlight and doing it in such a cool way. But, there's something called de-evolution, and there are lots of theories showing that the human skull is getting smaller and our jaws are getting smaller. And there's many reasons that this could be happening. But one of the main ways to combat it is to breastfeed and also to introduce foods that involve chewing. So many of these processed foods that we introduce to our children out of the gate, they're smushy, they're mushy. We don't need to chew or masticate. And that force of chewing really helps with our jaw development and creating these big, wide, broad, open airways. So it's really important to, whether you're in the baby-led weaning camp or not, I personally believe in kind of a blend of what works for you. It's not all or none. But, my girls used to gnaw on chicken legs and, carrots that were softened, of course, you blanch them and soften them. And it's really important for jaw development.
We're a huge fan of celery over here. Like
Yay.
The minerals in celery, and just having, like, when Bash's teeth were coming in, I'd put really cold celery, from clean it, chop it, keep it in the fridge, and then he would just go for it. And
Self-soothe.
I would feel safe knowing, like, okay, there's like strings there and I can keep an eye on that.
Yeah.
And he used to love it.
Yeah, that's brilliant. It's such a good idea because you're getting so many benefits. He's self-soothing himself so that you can perhaps go cook dinner.
Yeah.
And also he's chewing, it really is important. And there's a lot of myofunctional appliances now that are created, like silicone mouth guards and things that help replicate and stimulate that chewing mechanism in children, because we're trying to get them back on track at an early age if we're noticing jaws are underdeveloped.
How would you notice that a jaw is underdeveloped? What would you look for?
Well, it's the way the teeth line up, so there's something called a retrognathic mandible. So it's when the chin sits far back and maybe the teeth, think of it as an overbite, the front teeth come out far. That's not a great jaw relationship, especially for your airway. If the jaw is set back, it could be restricting your airway in the posterior region. So we look at that. We look at if the palate is narrow. So the roof of our mouth is the floor of our nose. And so if it is narrow, that tends to mean our nasal passages are narrow, which means it might be more difficult to breathe through our nose. So we tend to become mouth breathers. And we know mouth breathing is not ideal for humans. We should be breathing through our noses. When we breathe through our nose, we get more oxygen, we cleanse the air, we humidify the air, nitric oxide is released. And so we are seeing more and more mouth breathing too, more asthma, more allergies, more mouth breathing. And it's this vicious circle because mouth breathing begets mouth breathing. And it changes the way your face is growing too, which perpetuates your airway issues. So if you are noticing your child mouth breathing, even the littlest bit, or at night, if they're snoring or they're grinding, noisy breathing, breath holding, tossing and turning, spinning around the bed, night terrors, prolonged bedwetting, and then behavioral issues during the day, ADHD, all of these things are big red flags for us when we're examining a child's airway and sleep health. And very likely you should get that looked into. Either seeing a pediatric dentist who's really focused in airway health or an ENT, work with your pediatrician to But we really we want to be nasal breathers. It's really important. And that helps our microbiome too. So when we breathe through our mouths dry out and it changes the pH of our mouth. And pathogenic bacteria tend to thrive in that environment. And so we are in dysbiosis. So nasal breathing really helps protect our teeth. It is one of the major factors when a parent comes in and says, you know, I have 2 children. I do the exact same thing with both of them. This one has no cavities. This one has oodles of cavities. What's the difference? And I always think, is one of them mouth breathing? Because when our mouth dries out, our saliva isn't doing its protective mineralization, and we're more prone to cavities that way, as well as dysbiosis.
Wow, that's so fascinating. It's cool to look at it in the same family too, just because I'm sure that people have that. So many moms have had that experience.
Oh, I hear it all the time, and it's so hard because it's frustrating, and there's so much parental guilt out there, and that's really part of my approach to at my office. Is we need to get rid of the shame and the mom guilt. You know, we're all just doing the best we can. And so we're really just trying to unpack it and get to the root cause to help perpetuate future prevention. And so if we can help a child breathe better, that's going to have such profound downstream effects for that child, you know, potentially helping them be a more successful adult, you know, avoid sleep apnea and things of that nature, which are, again, they're really an epidemic. You know, sleep issues and breathing issues are really a problem in humans.
Totally.
Yeah.
Oh, I talk about mom guilt. Now let's jump into something that I feel guilty about, and I need to know what my game plan is.
Okay.
All right. So if you know the story, Bashi left St. John's Hospital when he was born and was put in an ambulance and taken to Children's Hospital LA. They thought he had HIE, which is oxygen deprivation, when he was born. So they put him on a cooling pad. He wasn't allowed to eat my breast milk. He was given TPN nutrition through an artery. And about a week later, they said, we're going to see if he has a sucking reflex. It's not going to be on your breast or a bottle. We're going to use a pacifier first. So the first thing that my son ever soothed himself with was I could barely touch him because I couldn't heat his body. Yeah. So my body couldn't touch his body really. It's in the box. They gave him the passy and he sucked it like Maggie on The Simpsons.
Oh, okay.
So that was a huge moment for Chris and I, because that was a sign and an indicator that our son's brain was healthy. And that he would be a normal little boy. It was a really big moment for us. And since then, Bashi has loved his passy.
Ah, yes.
From the moment, from the moment he got it, more than even breastfeeding, he is now 2 years and 4 months. And we try to keep the passies to the cage. They're all animals, right? The woman ups.
Okay.
And they stay, we try our best to keep them in his crib, which is their zoo cage.
Yep.
2 animals in the cage. But it is so hard for me to break this habit for him, because I just think about that moment so much, and it's tied to like this trauma for us as a family. And he loves his passy so much, and he like cares for them and wraps them in blankets, and it's a whole thing. He's very sweet with them, but I'm definitely seeing some changing in his teeth. Yes. Like his teeth are, the front 2 are forward. The ones right next to the front, I don't know, you know the names of these. They kind of go in a little bit. And I'm like, I'm sure when these teeth fall out, he'll have a chance to like that they would grow in and be normal. I wonder if we pulled the passies, was his jaw open up? Would they go back into place? Like, what should I be doing? Should I be pulling the passy? And what am I supposed to do about his little brother who's now here and, almost 4 months old and using a passy? I was sort of like, if we pull Bash's passy, then do I pull Tashin's passy at the same time and say like, no passies for anybody?
Okay.
Just give it to me straight, because I need to.
Yeah, I will.
I need education I always need science and scientific truth and research to change my behavior if I think it's an issue. And I'm obviously bringing it up because I think it's an issue. But
it's for many people. So yeah, I'm going to give it to you straight, and then I'm going to give it to you as a mom and a friend.
Okay, cool. Yeah.
So From an airway and jaw development standpoint, most myofunctional therapists and dentists, airway specialists like pacifiers gone around 6 to 8 months old.
Awesome.
So, and the reason is it can affect palatal development. Now, pacifier is based on frequency, duration, and intensity. So how often is your child doing it? For how long? And then is it Maggie Simpson? You know, do you have to like pop it out of the mouth, or is it left there passively? So when we're sucking on something, when we grow, the forces are outward, okay? So our jaws are going outward. When we're sucking on something, the forces are going inward. So they're opposite. So that's when we tend to develop narrow palates. And that's what I spoke of before. The roof of the mouth is the floor of the nose. And so if we have a narrow palate, we tend to perpetuate into a mouth breathing state. It has a lot to do with your tongue. So when our lips are sealed and we're breathing through our nose, our tongue should be suctioned up to the roof of our mouth. That's where it lives. That's the spot at rest for the tongue. If the palate is too narrow, there's not a big enough home for the tongue. So it can't get up there. So it tends to sit low, which perpetuates the jaw to drop open, and that can lead to mouth breathing. So perfect world, if I had a magic wand, I would make pacifiers go away, 8 to 10 months old-ish. I certainly like them gone by 1.
Okay.
That being said, it's all good.
We are long past that 1-year-old.
It's fine, but he'll be okay. So there are solutions. So I have a handout that I give parents on strategies for pacifier elimination. I will send it to you. I'm happy to share it with your listeners.
We'll put it in the show notes.
Yes, exactly. So I do think sooner the better.
Okay.
His bone is still pretty malleable. So the sooner we take it away, the more likely it will kind of get back on track. Mm-hmm. There is something called a myomunchie, which is a myofunctional appliance that sometimes can be a nice switch out for the pacifier. Okay. So, and there's a way to use that. You can check out their website, myomunchie. It's out of Australia, but if we could switch the pacifier with that, the goal of it is lip seal, nasal breathing, tongue in the proper position, and proper swallow pattern too. So, he's a little bit older, but you could talk about the pacifier fairy coming. Some parents do cold turkey, and then some parents just trim away the nipple a little bit. Every few days, you just trim it until it's down to the nub, and then you have a discussion and say, then it's going to go bye-bye. But, I would encourage you as a family to discuss eliminating it sooner than later. What I did with my girls is we made it an event. We put it on the calendar. We said it was going to happen on a Friday, and we didn't plan anything that weekend. And there was a lot of going in and rubbing the back and soothing. But honestly, I made it such a bigger deal than it needed to be. And my girls, after a couple nights, they were fine. We replaced it with a really special stuffed animal my girls are 5 and 7 now. They still sleep with that stuffed animal. But, you need to discuss as a family too, because there's an emotional attachment there as well. Yeah. So, but from an airway health standpoint, I would have to recommend to try to work on it sooner than later.
Yeah, definitely. No, I know it needs to happen. And I needed the airway, the science, just to help me do it, and to have that conversation with Chris.
It's going to help his jaw development, which is hugely important. And then also, we can get bad habits with it changes where our tongue goes and how we're swallowing and all of that too. So
all of that is way more important to me. Like, I want him to be a healthy little boy who grows up and doesn't have adult sleep apnea. Like, I want him to have like a big, strong jaw if his body is supposed to have a big, strong jaw. I obviously have like a mini pointy fairy jaw, like a Tinkerbell jaw. And my kids both have it. So at least like, makes them look a little more feminine. And so if his jaw is supposed to get a little bit bigger, I don't want to hold him back either. Like there are a bunch of, I can put a list together of like the reasons why I need to do it for me. And like Chris and I need to talk about it. It's one of the reasons why I wanted to talk to you today. It's like, I have these big questions. I'm not a dentist. I wouldn't say that my, I know blood sugar balance and eating, protein rich, healthy foods, healthy fats, lots of veggies. Like I know the Fab Four supports oral health, but
sure.
I don't know the nitty gritty that you're able to share with our audience today. And I want to go deeper into that too. So I appreciate you and that support.
I do want to say though, please, to any listener out there who maybe has an older child, they're 4 and 5 year olds still on pacifiers, and all hope is not lost. It just does mean they need intervention, and that it's orthodontic intervention. And they do a lot with biofunctional appliances and retainers and things like that. But the earlier we can get a child back on track with growth, the better. I like to treat kids as young as 3, 4, 5 years old for some of these things. So
That's great.
Traditional orthodontics, a lot of times we wait until all the baby teeth fall out and the child's like 11 or 12. It's way too late. This is a big debate in the nerdy dental world, but those that are studying functional dentistry and ancestral dentistry and things of that nature, really early intervention is better.
I love it. And I'm on board for that. Like, I think when it comes to anything health related, if we can kind of step in and change our behaviors and do something differently, or if we see that something's not working, I think parenting, that's all parenting is. It's like you're going down one road and you're doing what you think is the right thing. And if you learn something new, you edit that behavior. You don't feel bad about what you knew. You just you keep changing.
I love that. Absolutely. And that's, so many parents come in and they have such guilt because maybe their children have cavities or something isn't going right in their dental health. And we're just all doing the best we can with what we have. We're coming out of a pandemic. Cavities are skyrocketing. I've never seen so many cavities, but everyone's going to be okay. I tell parents, are your children loved and safe? And that's what's most important. And then I will take care of the teeth. And then we work together as a team to make changes that are easy and manageable to prevent issues in the future. And there you go.
I love it. Yeah. It's simplifying it. It's getting rid of the mom guilt, and it's trying to give people the tools.
The mom guilt. It
real.
Breaks my heart. I know.
So speaking of more mom guilt, let's talk about that pretty pink pill that I used to have to chew up in my dentist's office. Fluoride.
Yes. Okay. Fluoride. Okay.
We had a heated discussion on Instagram. I didn't mean to create that. I just was like,
oh, it happens to me all the time. Don't worry.
Okay. Okay.
Okay. So fluoride is very controversial. It's very triggering to many. It is almost like talking about politics or religion among many dentists. And that really bums me out because I just think we need to be having open, mindful conversations about latest research. So, I was trained traditionally. Everyone gets fluoride. And if you don't grow up in a fluoridated community, you write prescriptions regardless of a child's cavity risk, just handing out fluoride like candy. And I used to practice that way. And again, this is when I had my aha moment. I was just, seeing cavities and cavities and cavities. It's the #1 chronic disease in children in the world. Wow. And it's on the rise. So it's a big deal, and it's preventable. It's almost 100% preventable. To me, fluoride, though, is a bit of a Band-Aid. What is the real root cause? It's not that we're fluoride deficient. It's diet, and it's how we're breathing. So the thing with the argument with fluoride, it's not that fluoride doesn't help strengthen our enamel and reduce acid attacks. It does work on the teeth, but this is again the functional approach. We need to look beyond the tooth. So what is it doing to the rest of the body? And there is a lot of research out now to indicate that we should be very concerned, particularly about systemic fluoride and its effects on brain development in babies and children. There's been 68 very reputable studies that have come out with big concerns about systemic fluoride ingestion. And part of the issue is we can't titrate it. So, and again, I'm talking about systemic. I'm not talking about topical. So I'm talking about ingesting fluoride, not toothpaste and things of that nature right now. So if you live in a fluoridated water community, you may be a marathon runner and you drink copious amounts of water a day. And I barely drink any water at all. Well, you're getting so much more fluoride than I am. What is the proper dose? It's very dose dependent. There's also fluoride in processed foods and naturally occurring in some of our foods too. And you guys can look that up, but tea has fluoride in it. And a lot of beverages have fluoride in it. If they're made at a fluoridated community, a factory that's fluoridated, they're not doing reverse osmosis before they make these products. So being mindful of that. And then you're using toothpaste too, and your child's swallowing it. And it's just too much. When we're starting to see an increase in fluorosis in teeth, and that's when the teeth get mottled and chalky, and they can actually be more susceptible and fragile. So there's a lot of research out there now. There's actually a lawsuit, a trial happening in San Francisco against the EPA, which could be very monumental. It's a lot of expert epidemiologists, researchers, not dentists, biochemists coming forward saying they do have concerns with systemic fluoride and water fluoridation. 97% of the world is not fluoridated. It's a very United States centric thing. And I just would like us all to just have an open conversation about it. I have concerns. I can't look a parent in the eye and tell them that I think ingesting fluoride is beneficial for their children, especially now where there's other products that can help remineralize our teeth, one being hydroxyapatite, and I can get into that later. But really, we're missing the root cause, which is diet and how we're breathing, So I do think topical fluoride can have its benefit with certain high risk patients. I don't like it long term. I like it just until we reach stabilization of the disease. But I hope we can have more open conversations. I think we're slowly seeing a movement away from fluoride, but it's going to take a long time, and I wish it wasn't so triggering. I wish we could have more open conversations about it, because again, this is about the health of our children and their brain health. They're finding lower IQs and signs of ADHD. That's what these studies were showing in children who are exposed to high amounts of systemic fluoride. And that's very concerning.
Yeah. I'd rather my child have their brain instead of their teeth, if that was the issue.
Well, that's the thing, right? I mean, again, right. I mean, teeth are important, but it's the risk benefit analysis. And
right.
if we could just spend all this time that we are arguing about it and using that time to educate patients on prevention through diet and hygiene and proper breathing, I just think the outcomes would be better. Because again, we're using fluoride a lot and we're still seeing cavities, and we're still seeing cavities on the rise. And it's truly because our diet it can't compete. Fluoride can't compete with this processed food diet and, sugar and everything and refined flours and things of that nature.
So that's a perfect segue. I think that you touched on fluoride enough, and it can be a parental decision and the conversation that they have. I think as a parent, we need to know that fluoride's been in practice in traditional dentistry for a very long time. They're educated, you were educated as a dentist to use it as a first line of defense, but since then have opened your mind and eye up to open yourself up to like more of a holistic functional approach. And I'd love to go into hydroxyapatite. I'd love to go into a little bit more of the diet, the D3, the K2. Should we be supplementing? How can we really get get to a place of prevention?
Yeah, I love to talk about this stuff. So hydroxyapatite, it's been used in other countries for several decades. It's really becoming popular in the United States, especially among functional dentists. But hydroxyapatite is really what is in our enamel and dentin to begin with. So what it's doing, it's kind of a calcium derivative, if it's an easy way to think of it. And so it's replacing what's already missing. So what fluoride does, it actually completely changes the structure of our enamel. Hydroxyapatite is replacing missing components of hydroxyapatite, if you will. So it's a much more natural way to remineralize our teeth. And it's very successful. There was a research study that just came out a couple months ago comparing it to fluoride and showing it's as effective and if not more effective than fluoride. And I think there'll be just more and more research coming out. It has no systemic side effects. There's no concerns with toxicity. So to me, it's kind of a no-brainer. I mean, why are we not talking more about this? And again, I'm hoping slowly dentistry makes a move toward at least a conversation about it. But yeah, so I recommend hydroxyapatite a lot in my practice for my patients. From nutrition standpoint, we talked about D3 and K2. I personally have my children on D3, K2. I think most of us are deficient. I live in the Pacific Northwest. We can be outside as much as we want to be and eat as much of the wide range of food as possible. But I mean, I know myself, I'm still D3 deficient. So I supplement, my kids supplement with K2 also. I like kids on that. Obviously work with your pediatrician about that. We need fat soluble vitamins. That's why I love liver and organ meat and cod liver oil and all that good stuff. Vitamin C is incredibly important for gum health, collagen. We need magnesium, phosphorus, calcium, probiotics, prebiotics, trace minerals. So, it's again, what's good for the body is good for the mouth,
Cool. I love that so much. And you sort of touched on it, but sugar and processed flours, like what's happening there when we're bathing our teeth and soaking our saliva in that stuff?
Yeah. So another reason we're getting cavities so frequently, besides the way we're breathing, in my opinion, is how we're eating processed foods. So we all kind of know sugar is not great. Our pathogenic bacteria love carbohydrates. That's what they metabolize. When they do that, they release acid. So every time we eat, technically our pH in our mouth drops. But when we're eating refined sugars and flours, that process happens very quickly. I mean, it's very similar with blood sugar, right? So it's just not a natural process. Part of the digestive process has already occurred due to the refinery of the flours and the processing. So you eat it and boom, immediately it turns to sugars and acid in the mouth. Well, the other problem is a lot of these processed foods, especially geared toward children, are really sticky. Fruit snacks, crackers, pretzels, chips, granola bars. I mean, I tell parents, think about after you eat something like that. It's all throughout your teeth. It's stuck in your teeth. You might use your tongue to manipulate it and kind of pick it out. Kids don't. They'll let it sit and chill there all day long. So it's just sitting there and the bacteria is feeding upon it, constantly releasing acid. The other issue is a lot of those foods, they don't satiate us. So we're going back to eat more and we're grazing, and a lot of kids graze. So they snack on crackers all day long. So your mouth is constantly in an acidic state. You're never allowing the body to naturally remineralize through our saliva.
Wow.
So eating on a schedule, again, this is tying back to blood sugar. I know.
I'm over here with my hands in the air. Yes.
Eating on a schedule. Again, this is the whole body connection, right? So and this is why I think cavities have been increased during COVID. Number one, parents are tapped out and overwhelmed, but also kids are home snacking, they're bored. You know, parents are on a Zoom call, go get yourself something to eat. What's the easiest thing for kids to grab? A bag of goldfish crackers or, you know, something like that. So, we like to eat on a schedule, you know, every 2 hours. So I like parents say, you know, breakfast at 8, have a snack at 10, ideally like a whole food type of snack where you sit, you eat it mindfully, and then you're on your way, you know.
Something you can chew, something that doesn't stick to your teeth.
Yeah.
Yes.
Yep. And I have lots of snack ideas, you know, I love nuts and seeds, seaweed snacks, fruit's okay. I don't love it all day, every day. But you know, fruit's great. Veggies, hummus, salsa, guacamole, you know, you can do tofu cubes with tamari, chunks of meat, cheese sticks, fermented foods, pickles, you know, olives, things of that nature. Those will not cause cavities. Like you could really eat as much broccoli and hummus as you want. You're not going to get cavities from that. It's truly the processed foods. And what's interesting from an anthropological standpoint, cavities are pretty new to humans. So if you look at human skulls, from about 10,000 years ago, we didn't have cavities, not to the degree we do now. I mean, it's epidemic right now. So a lot of that is attributed to the agricultural revolution, where we started harvesting grains. And then more recently, the industrialized revolution, which is when we started processing and refining grains. And we've just seen this major influx in cavities because of these foods that we're eating. So cavities are not in human destiny per se. We've created them through our food system.
I'm looking at it going, all we wanted was fast, quick, and easy. And now we're getting the backlash of all of that in every aspect of our life, from our oral health to diabetes, heart disease, inflammation, you know, all of it. It just all links back together. And I love that you are connecting the mouth to the rest of the body, because it's not separate.
It's not separate. It's the entryway. It's literally the entryway into the body. You know, we talk a lot about, in functional medicine, they talk a lot about food as information. And with every bite of food we're putting in our mouths, we're choosing potentially a path towards health or, you know, being unwell. Well, it starts in the mouth.
Yeah, definitely. And there are links to the oral microbiome being the same microbiome that your child has in utero. We used to.
Oh, absolutely. Yeah, that's a great point. Yeah, our babies get our microbiomes from their moms. And, you know, whether ideally vaginal birth that contributes to it, breastfeeding, snuggling, being close to one another. And that's where one of my focuses is moving toward now too, is focusing on pregnancy. Because we know your child's microbiome and ultimately dental health, it starts arguably before pregnancy, but how important it is to eat nutrient-dense foods and be nourished and rested and hydrated and breathing properly and have a healthy gut microbiome and healthy oral microbiome when you're pregnant, because that is all going to be translated into your child.
Oh, so powerful. So powerful. And then I even think about my husband, Chris, like, you know, mouth open, snore baby. And I'm like, we got to get that cleared up. We're going to use those nasal strips. We're going to tape his mouth.
Lip tape. Oh, I lip tape every night.
Do you really?
It's also that's so controversial too. It's yeah, every night. I feel like $1 million. And mine's a jaw relationship issue because of my bicycle accident. I'm kind of a hot mess. My airway's all messed up from that, but you should check out the Breathe Institute in LA.
All right.
You should go see them. Dr. Zoggy I'm a fangirl of Dr. Zoggy also. He's changing the world. So Chris should go see him.
Okay, cool. I love it. I
Yeah.
love all these tips and tricks. I'm definitely going to get him to go up there because we got to do something about it. We were going to do, someone told him he needed his tonsils out because he opens his mouth and his tonsils basically almost touch in the back.
Oh, yeah. Yeah.
So they're like, you got to do something. You're breathing with your mouth open, you're snoring. I was in tears, pregnant with Sebastian. Like, I'm not sleeping because he's
Well,
snoring.
and that's so interesting because it affects the family.
Yeah.
If a child isn't getting good sleep, it doesn't just affect the child, it affects the parents, it affects the siblings, it affects their friends and their teachers, in theory, if their
Yeah.
behavior is being affected. It's the same with us as adults. We're affecting our partners. And if we're tired, we can't be present for our children as much. And, sleep is so important. It's critical. I mean, it really is the foundation, is quality sleep. I can't emphasize that enough. So watch your children sleep. This is a point I'd like to make. I ask a lot of parents, does your child mouth breathe? And they're like, I don't think so. And I say, well, while they're asleep, go observe them. Are they mouth breathing? Are they grinding? Are they snoring? Are they craning their neck back, like trying to open their airway, spinning around? Take a video, take a 3 or 4 minute video and show that to your provider. All of this is not normal. It's common, but it's not normal. And so we've normalized snoring and these breathing issues, but it is a sign of an underlying issue that should ideally be addressed, whether through seeing an ENT. Myofunctional therapy is huge, and that's where the Breathe Institute could help Chris too. They have myofunctional therapists that really work with training to get those lips closed, that tongue up, and nasal breathing.
I love it. He's going to hate me for this, but we're going to do it.
Sorry, Chris. It's really because we love you.
Yeah, I know. Seriously. I'm always
my husband's the same. I finally got my husband to lip tape.
Awesome.
Yeah,
I love it.
And of course, it took me about 18 months. And then the first day after he lip taped that morning, he said, wow, I feel great. It's like, yeah. I've been telling you.
Yeah. They have to come to it on their own though.
They do.
I'm trying to see. I was writing a bunch of notes over here. I just want to make sure that I'm not missing anything. I think we pretty much nailed it. When should people take their child to see a dentist first?
The recommendations around 1, I like to see babies even earlier because I want to educate the parent on all the things we just talked about. And also I am looking for lip tie and tongue tie, which can get missed quite frequently. And that can affect jaw development and it can lead to mouth breathing and other issues too. So we just want to have a conversation about that, but ideally by 1. And I know a lot of parents are nervous about bringing their children to the dentist. Generally a pediatric dentist, they really keep it positive and fun. It's mostly an educational visit. Remember that your children do feed off your emotional energy. So if you yourself are afraid of the dentist or have had a bad experience, try to meditate before you bring your child in, because I promise you their experience, especially at a pediatric dentist, will be very different. And that's our ultimate goal. My goal is always a positive experience for the child. It's well beyond the tooth. I care much more about their emotional health than about that little baby tooth. So, try to find a provider that resonates with you too.
I love that. We took Sebastian. We have a family dentist that does everybody. And we took Sebastian with us and he got to wear the headphones and watch the TV and watch mom get everything done. And then he actually fell asleep on me watching Number Blocks on Netflix on the ceiling.
Oh, perfect. Well, so he has no fear.
So then we went back a couple of days later and then, it's like most kids. He's like, he let them look in his mouth for a second and count his teeth. And then he was like over it. And so it was more like, here, touch this tool, get comfortable in the environment. And then we were just, they told us, just brushing his teeth morning and night and flossing. And we have a Sonicare we each do, and he likes an electric toothbrush. So
that's what I recommend. Yeah.
Okay.
Yeah. I do want to touch upon that too. Flossing. I mean, my PSA is please floss your children's teeth. So the number 1 place I see cavities in children are in between the back molars I mean, almost 100% of the time. So it's not from not brushing, it's from not flossing. So generally around the age of 2.5, those molars are in and touching. And I cannot emphasize flossing enough. It's a non-negotiable at my house. I like parents to think of it sort of like putting your child in a car seat or putting their seatbelt on or their bike helmet on. You can make it fun. What we do is we attach it to an existing routine, which is reading nighttime stories. So we have a bowl of flossers right in the bedroom, and we floss teeth right when we're reading books.
Love that.
Yeah, and a lot of parents have concerns with those floss picks with the plastic waste, and I don't disagree about that. And that is something I've been working on and have coming out soon is a biodegradable, compostable floss pick for kids and adults. So stay tuned on that. That's launching soon.
I love that. That's so exciting. That is awesome. And then I know you've said this on your Instagram before, but can you give us some background on floss and endocrine disrupting chemicals? And is there something we should be looking for?
Yeah, you want to avoid petroleum-based or Teflon. It's called PFAs in floss. Though it's concerning, endocrine disruption. There's been some links to, cancer-causing agents in those too. So really try to look for a floss that BioSilk is really ideal. I mean, I'll be honest, there's room for improvement in the floss market for sure. And you have to be careful. Some of those floss picks, which is what I do recommend for parents. It's just so much easier to use those little picks.
Yeah.
They can be impregnated with fluoride. So if you are choosing to be a non-fluoridated home, you just want to be mindful about what's in there. But, Risewell has a hydroxyapatite floss. It is the string. So you'd have to get one of those reusable floss winders. Easy Floss is the brand that I sometimes recommend, but you do want to be careful with the floss. And a lot of dental products have not so good chemicals in them that can disrupt our microbiome. And I have more of that on my Instagram too, but be real careful with oral rinses and essential oils and all of these things they're really killing our healthy bacteria too. So you just want to be careful.
I love that.
Less is more. Less is more.
I'm into it. Less is less expensive too. So
Totally.
Staci, I cannot thank you for being here. This was such a fun conversation.
Yay,
I know so many moms are going to have to start over, play it again, take notes, but we'll put everything in the show notes, all your favorites, links to your Instagram and website. You keep me posted when your biodegradable flossers come out, and I will share the good news. But where can people follow along with you and learn more?
Yeah, so I'm mostly on Instagram right now, Dr._Staci, and doctor is spelled out and it's Staci with an I. If you're interested in having me do a consultation, I do offer virtual consultations. I actually am a health coach also. So they can find me on NOPO Kids. It's NOPO Kids Dentistry. That's my office. And I can get you set up for that. And then I'm having a Kickstarter campaign for these flossers because they're one of a kind. And so I do need to raise awareness and funding to get the machinery developed to bring these to mass production. And that will be on happyfloss.com. You can jump on there and check out the Kickstarter that I have going.
I love it. Such good stuff, Staci. Changing the world one tooth at a time.
Yes, I hope so. And to your listeners, please reach out to me if I feel like I could talk for like 3 more hours about all of this. So
we probably could.
Reach out to me if you have questions. Yeah.
Awesome. Well, thank you for your time today, and I'll keep you posted when this goes live.
Thank you so much, Kelly. I really appreciate it.